Welcome to the Dizziness Summit. We're here today with Dr. Joseph Coppus, who's a lead clinician for the Neurologic Wellness Institute in Chicago, Illinois. Dr. Coppus is also the host for their Neurologic Wellness Podcast that you can download on Apple Podcasts as well as Spotify. Thank you so much for being here, Dr. Coppus.
Thanks for having me, Dr. Traster. I'm really excited for this Dizziness Summit and to present on BPPV. It's nice to be on this end of the microphone for a change, presenting a little bit of information. So I'm excited for this.
I'm excited for this too, because BPPV is a really common form of dizziness, and I'm really interested to see what you have to say today.
Yeah, BPPV is very common, yet still debilitating. So I'm very excited to present on this topic and hopefully help people out there who are suffering with it.
Perfect. So let's get started. Dr. Coppus, what is BPPV?
I'm glad you asked. So BPPV, basically what it means is it's Benign Paroxysmal Positional Vertigo. So what do those four words mean? Benign basically means that it's non-lethal, it's not life-threatening. Paroxysmal means that it happens in fits or bouts. So it's not like a constant dizziness. Positional means that it's exacerbated by head position. So people with BPPV, when they move their head in certain positions and angles, they tend to bring on the dizziness. And then vertigo is our definition for spinning, or this rotational component to dizziness. So not all dizzinesses have this rotational component, but one of the key indicators for BPPV is this rotational component of the dizziness. The next common question I get with BPPV is, I guess, what does it feel like, or how do you know you actually have BPPV? The literature characterizes BPPV as a fit or a spell of rotation, like I said, that lasts anywhere from 30 seconds to 2 minutes, and is typically brought on by rapid head movements. A lot of times patients are going to feel this dizziness the most maybe when they go to the hairdresser and they put their head back quickly. Maybe they roll over in bed and all of a sudden they're spinning. Then who is actually likely to experience BPPV? First off, anyone can really get BPPV or develop BPPV, but typically what we see most commonly, patients come in after a head injury, whether it be concussion or the population of a patient who's more prone to osteoporosis. Something else we really like to consider with BPPV are some of the secondary issues that come into play, especially with this osteoporotic population. Just imagine being dizzy or experiencing vertigo in your older age. Balance is already compromised. This predisposes patients even further to fall, risking hip fracture and other severe complications. So these are things we do not take lightly here at NWI. I've talked a lot about who has BPPV, so what actually is the problem? So why people with head injuries and people with osteoporosis are most likely to develop BPPV is because what it is essentially there are these crystals or these stones. They're in the inner ear. They become dislodged and they exacerbate a feeling of rotation. So let me take a step back. As you can see on your screen here, we have the inner ear, the eardrum, and then right here is your vestibular system, your semicircular canals. So what happens is these stones you see, these otoconia, they get dislodged, whether it be from a head injury or just kind of come out due to osteoporotic processes. And because they're free floating now in the vestibular canals, they think of it like a water bottle that we filled up with water. This is a normal, healthy semicircular canal. And then imagine that there are nerve fibers, free-ending nerve fibers inside of the semicircular canals. And whenever that fluid flows past those nerve endings, it tells your brain that your head is moving, right? So if I move my head like this, my vestibular canals tell my brain that I move like that. But what happens is once these stones are free-flowing in the canals, they perpetuate this signal. They continue to stimulate these nerve endings that are in the vestibular canal. So I go like this, and maybe that's the exacerbating head position for me. I go like this, and now not only do I get that initial response of my head was moving, but because these stones are in there, they continue to perpetuate that feeling of rotation. So I feel like I'm continuing to spin forward. So this can be a very disorienting condition for people, very debilitating. And with this, the most common location for these otoconia, these stones, to be dislodged and free-flowing is the posterior canals. That happens in 90% of BPPV cases. So what that means is the most common exacerbating head position for these patients is looking back over your shoulder, looking back, looking straight up. That being said, all of the semicircular canals can be affected. So this is why a thorough examination is important. And that's where we come into how is it diagnosed. Unfortunately, diagnosing BPPV actually requires placing the patient in the position that tends to exacerbate their dizziness. So in order to diagnose BPPV, we put your head back into this position like this young woman is, and we look for a certain eye pattern. So let me show you what the eye pattern is and what we're looking for here. So this is called a nystagmus. So what's going to happen is the eyes are going to start to drift in one direction and then quickly beat back towards center. So just looking at the way these eyes are moving, you can empathize with how disorienting this this condition can be. So then, most importantly, how do you actually fix BPPV? How do we treat it? So fixing BPPV is done with the Epley maneuver. This young woman or man is being put back into the right posterior canal head position. And now the doctor is going to slowly turn his head to the left, as you see. He's going to turn it, and then they sit the patient back up. What is actually going on when the doctor is doing this? So you can see, if you remember the free-floating stones, the otoconia in the semicircular canal, what's going on is we bring your head down, we let the stones settle, we move the head again, allow the stones to settle, and then we move the head one more time, and then those stones should settle right back where they belong or where they were dislodged. And then if we can help those stones basically go back to their original location where they're supposed to be, where it does not make you dizzy, then we can essentially, for all intents and purposes, cure BPPV. This isn't always a one-time fix. This is the standard treatment, but sometimes it only takes one maneuver in order to fix BPPV. Sometimes it takes two, sometimes it takes more. But this is the way it's done. This is the way we treat BPPV. So a lot of people may think, oh, that sounds really easy. Is that all there is to fixing BPPV? In many cases, yes, that's all patients will need in order to resolve their vertigo. However, 2/3 of patients who experience BPPV and then undergo the Epley maneuver to fix BPPV oftentimes will develop something called residual dizziness. Now, this is just an unfortunate side effect that a lot of people do experience following the Epley maneuver. The residual dizziness is something that we have to treat if it comes up later. And that's where we can really shine at NWI, and that we can help with the residual dizziness following BPPV. So what exactly is residual dizziness, and something you should be aware of if you think you're experiencing BPPV? Like I said, 2/3 of patients will experience the residual dizziness, and it can last up to 3 months. But here at NWI, what we try to do is reduce that recovery time. And the way we do that is we do specific eye, head, and body exercises to reintegrate your vestibular system with your oculomotor system, as well as your proprioceptive system. That way, all of these systems are telling your brain the same thing. That way you can move around the world without feeling dizzy, without losing your balance. You can do it effectively. Just to wrap things up, some final remarks, things to remember and take away is BPPV is a very common condition. It can be very dangerous and debilitating. However, it is non-lethal. And most importantly, BPPV is curable with the proper diagnosis and treatment.
So Dr. Coppus, why do you think it's important for somebody to know what BPPV is?
Well, Dr. Traster, BPPV is one of the most common forms of dizziness. So that in the forefront should be known by most people, especially if you're experiencing dizziness. And it's especially important to know because it is so easily diagnosed and treated with the proper clinician. So if a patient is experiencing BPPV or dizziness, this is maybe one of the first things they should consider, because it can be a very debilitating condition, like we mentioned in the presentation. So we want to get this fixed as soon as possible, free up the patient to live their life.
So Dr. Coppus, what was really interesting was the correlation you made with head injuries and concussions and BPPV. So can you talk a little bit more about that?
Yeah, so oftentimes with concussion and dizziness, or with BPPV, we do see the two conditions go hand in hand. It's not always necessarily BPPV that we see with concussion, but a lot of concussion patients do present with some type of dizziness. Oftentimes it is BPPV. It's to the patient's benefit to really to find a clinician who is well versed in both head injury and the issues that come along with that, as well as vestibular rehabilitation, and someone who's able to marry those two issues.
Thank you so much, Dr. Coppus. It was great to speak to you, and I'm sure this really helped a lot of people watching. So thank you, and I'll speak to you soon.
I hope so. Thank you again for having me on today, Dr. Traster.